over the bones of the human spine. So the vertebrae. I will turn this on the back. So we will be going over the vertebrae. We will also be going over the sacrum and the coccyx. Here we have the atlas vertebrae in the anatomical position. We have the anterior, posterior, the superior, inferior on the bottom, and then we have the sides. Starting here on the anterior side, this green right here is the anterior tubercle of the atlas. Now, this whole area here, this arch right here, is our anterior arch. Turning it so that the posterior side is facing us. In here, right in here, we have the facet for dens. Then we have facing us the posterior tubercle and the posterior arch. Turning it back to anatomical position, these orange on the sides are the transverse process. Transverse process. Okay. And then these holes right here on either side are transverse foramen. Now, these blue right here are facets, and they are superior articular facet. On the inferior side, we have inferior articular facet. And lastly, turning it back to anatomical position, this big hole in the middle is our vertebral canal. That is the atlas. This is the axis, or C2. It is in the anatomical position. We have the anterior, posterior, superior, and inferior. The green right here that's sticking up is called the dens. On the inferior side, we have here the body. Dark blue is the body of axis. Then, turning it back to the superior view, these orange that go all the way around like this. This is our pedicle. On both sides, we have pedicle. Then we have transverse process. You can't really see them on this vertebra, but it's going to be these little edges that stick out right here. Okay, so we have transverse process here. Looking at it from the lateral view, we have transverse foramen, that hole right there, and the hole on the other side, right in there. Transverse foramen. Continuing, this is the superior view. So we have here, these are our superior articular facet. On the inferior side, right here, we have our inferior articular facet. These pinks. On the posterior side, I will turn it. We have here the pinks. These are the lamina. And then the blue is surrounding the bifid spinous process. Cervical vertebrae 1 and 7 do not have a bifid spinous process, which means 2 little divisions there. But cervical vertebrae 2 through 6 have a bifid spinous process, and that is the axis. Here we have the cervical vertebra in the anatomical position. We have the anterior, the posterior, the superior, and the inferior is underneath. Now, on the superior view, right here, is the body of the cervical vertebrae. It's also on the inferior. This whole thing that I'm holding right here is the body of the cervical vertebrae. Next we have the pedicle. Now the red right here is the pedicle of the cervical vertebrae. Goes all the way around there. Now we have the transverse process of the cervical vertebra. So that would be this gold tape right here. And it would be right here. The transverse process has 2 tubercles, however. It has an anterior tubercle, this little edge, and a posterior tubercle of the transverse process. On the transverse process, this groove that's right here is called the groove for C4 spinal nerve. This hole right here, once again, is transverse foramen. Only cervical vertebrae have transverse foramen. Then we move on to the superior articular facet. We are in the superior view, so superior articular facet. And turning it over, the dark blue is our inferior articular facet. Turning it so the posterior view is facing us. The orange right here is our lamina, and the blue is around the bifid spinous process, once again. And down the middle is our vertebral canal. And that is the cervical vertebrae. This is our thoracic vertebra. It is in the anatomical position. We have the anterior, the posterior, the superior, and the inferior side. The thoracic vertebra has a body, is the body of the thoracic vertebra, and on the bottom side also, the body of thoracic vertebra. These dark blue right here, and basically where the zip tie is, the dark blue is the pedicle. So this is the pedicle of the thoracic vertebra. These orange ones, we have one on the superior view and one on the inferior view. These are called demifacets, costovertebral demifacets. So in specific, the top ones here on the superior are superior costovertebral demifacet, and the one on the inferior side is inferior costovertebral demifacet. Then we move on to the transverse process. These yellow are the transverse, this whole thing, and then yellow is the transverse process of the thoracic vertebra. And this green right here on the end is called costotransverse facet. Those are only on the thoracic vertebrae. Costotransverse facet. Now, turning on the side here, this notch that you see down here, this is the inferior vertebral notch. The superior vertebral notch would be up here. Kind of can't see it, doesn't really make a notch, but this is our superior vertebral notch, or right here, superior vertebral notch. Then turning it so the posterior view is facing us, we have here these pinks, superior articular facet, and on the inferior side we have the inferior articular facet. Moving back to see the posterior view, the blues are the lamina, and the red is surrounding the spinous process of the thoracic vertebra. And lastly, the big hole in the middle is our vertebral canal. And that concludes the thoracic vertebrae. Our last vertebra is the lumbar vertebra. This is in the anatomical position. It is the anterior, the posterior, the superior, and the inferior would be underneath. Now, this yellow, the big part right here, this whole thing is the body of the lumbar vertebra. These green on the side are the pedicle of the lumbar vertebra. Pedicle. Then we have these that stick out to the sides. Now I'll show you from the posterior view here. They stick out in the transverse plane. So they have their transverse process. Then we have superior articular facet, which is this orange. Superior articular facet. And on the inferior side, we have inferior articular facet. Turning it back on the posterior view. On here, this little edge looks like this. The edge of that. This is the mammillary process. This is the mammillary process. Underneath mammillary process, in between that and our transverse process, we have here this purple. That is our accessory process. We also have it on this side. This right here, these are the lamina lumbar vertebra. And then we have our spinous process. Right here, this whole thing right here is our spinous process. Lastly, the big hole in the middle is our vertebral canal. And that is the lumbar vertebra. This is the sacrum in anatomical position. We have the anterior, the posterior, the superior, and the inferior. This big yellow right here going down the center on the ventral or anterior side is the body of the sacrum. This orange edge right here is called the sacral promontory. It's the edge right here. This top area up here is called the base of the sacrum, and the bottom area is the apex of the sacrum. Staying on this ventral or anterior side, these green right here on the sides are our sacral ala. Then on these sides right here, this side and this side right here, are our auricular surface of the sacrum. Now, these holes right here on the ventral or anterior side are called ventral foramina. Now we will flip it over for the dorsal or the posterior side. Now, on the posterior side, up here, these blue, we have the superior articular facets. Okay? And then in the middle, right here, there's a crest that sticks out. That is called the median crest. And these on the side of the median crest, these yellow are called the intermediate crest. And these orange on the far lateral sides, these are the lateral crest. Then turning it from the superior view, right in here, this big hole where the orange tape is, that is our sacral canal. And then the exit of that canal down here is our sacral hiatus. And that concludes the sacrum. This is our coccyx in the anatomical position. The anterior side, the posterior side, the superior and inferior. The orange right here on the anterior side is called articular facet for S5 body. These yellow little horns right here, those are called the cornua of the coccyx. Cornua. Now, these edges right here and right here going to the sides are the transverse process of the coccyx. Lastly, on the posterior side of the coccyx, there should be an exit, or basically like a little groove, for the spinal nerve. And that concludes the coccyx. This concludes the vertebral column, which was the vertebrae, the sacrum, and the coccyx.